hard. But we have one part, we have normal, right? It's uncomfortable. So we have to divine. So we have another issue on respect to action or on respect to issue every day, but it not cover all your body or span or the bite your lifespan, right? The visible part. So you have to control, you have to more divine the partly, okay? The divine source. The centers yourself take a moment of silence to acknowledge your divine fusion. The center of yourself take a moment of silence to acknowledge and the divine presence. Ask for permission. Who approve? Ask for permission. Who? If praying for someone, yes, if we praying for someone, always ask, may I pray for you right now? And can I place a hand on your shoulder and consider the cradle shape agreement for healing? Okay, Madam, I want to pray for you, right? So can I pray for you now? So you have what kind of issue, what kind of problem? So you told me I understand your situation, right? And because you have some the car accident this morning, so I don't know that. So you want more injury was the trauma, so you want more pray for my body or some of the trauma, right? Car accident. But I don't know your situation. Just I must say pray for you something. You don't know, right? It's not match, no power. So you have to give me the issue of prayer, and also I have to learn the situation, and then first I have to ask, right? Maybe it's rude. Maybe you don't want to pray, but I want to pray for by myself. 1A, no. It's a no match, right? So every time, if you have to feel out your heart, oh, I want to pray for somebody because I'm the holy person. But sometimes, other side, the people, they don't want to pray from me, right? So we have to more agree. So can I pray for your situation? Then you say yes. Then how can I do? How can I for the prayer? So you have to please give me the information, and then I want more the channel A, B. You are channel A, I'm channel B. It's not matching, right? So the channel A and channel A. So we have the more the parliament or the prayer. So we have the more signal, same signal. But first ask the step. Okay. So ask for permission. If praying for someone else, always ask, may I pray for you right now? What kind of your problem? So what do you want? Your sick problem, or family issue, or finance problem, anything. So we have to know the issue, okay? And you have to keep the secret, contact everybody, okay? So each by person private, right? The private area. So can I place hand on your shoulder? So we have the skinship or your head, or usually we have the burden or the shoulder, right? So if you want to touch the body, you have to ask permission. The concern, the credit saver, environmental healing. The step 2, the interview. The dynasty first. This bleed into a question centers approach we discuss. You want to know what you are actually aiming. So you have to. You want to know what you are actually aiming at. The question. What would you like God to pour your today? What would you like God to do for your today? The go deeper. If they say, I have a headache, you might ask, is there any stress or specific event tried when he started? When this started headache, especially the kid. So we have to catch chance. So when I have more some the headache because this morning I've oversleep, so I'm very hurting. I lost, so I'm going to try to come early to school, but too much traffic and then some car accident, so we had to delay. Yeah, so I'm headache and nervous. Yeah, because Joey want to come on early, but traffic, so Dr. Choi is very angry, right? Right? So sometimes we don't know, right? So everybody have stress. Look, so we have to know that the question. Number 3, the invitation, the invocation. You let feelings power down. You are inviting it in. You aren't calling power over down. You are inviting it in. The prayer, you simply invite the Holy Spirit to be present. The prayer, you simply invite the Holy Spirit or the divine to be present. Example, the happy with the example. Will comes your present here, come and bring your peace and healing power to name. So we welcome your friends here, come and bring your peace and healing power to Joy. So Maria, what's your name? Window. So we have the name, okay? So we have to pray for and give it a power, mind over prayer, and then last one you have to may add more name. Step 4, the prayer over command or petition. This is a more health, feelings prayer, different from the standard hopeful, no negative. So okay, maybe your situation much better, so your body conditions much better. So you have to give it a more standard hopeful prayer, okay? No negative. There are 2 main ways to approach this. Petition, asking, God, please reach into this person's heart and heal the grief they are carrying. So God, please reach into this person's heart and heal the grief they are carrying. Okay, the petition asking. The command. Authorities, based on the belief that the spiritual authority has been granted the believer, in the name of Jesus, I speak life to the dead lover, the pain you must leave this body. Note that this isn't yelling, it's a calm, quiet confidence. So no yelling, it's a more powerful the voice. In the name of Jesus, divine, I speak life to death lovers, pain you must leave this body. This isn't yelling, it's from the quiet confidence. Okay, so based on the belief that the spiritual authorities have been granted to the believers. So I want to mention about the believers more the positive imaging. I have a lot of the patient every day. Very place. So some people sickness long time, the chronic disease, or some people have the acute. So headache or stress. So I too much people anxiety, right? The anxiety. Last week we learned the anxiety culture. So too much anxiety person, they want to more calm down and then they will relieve of stress or pain, right? So I want to try to more approach more the prayer and then treatment. Some patient negative person, they delay the treatment. But positive person more quickly removable or the pain or something issue and the more the peace of mind and the more healing, more improve the situation. So we have here, there's so many students here. Some people have negative mind and some people the positive mind, the different. So I know 2 hour class hour is not sure, it's a very long time. some people live just around here, maybe 10-minute driving here. Some people from the 3 hour, 2 hour, they're driving from house come here. I'm the 3 hour this morning. I wake up 5:30 a.m. I'm driving 3 hour, but fortunately today very short driving, no traffic. But usually the one students come 2 hour, maybe transport bus take time. So they have more ambition, right? They more and more try to more work hard and then more because of more listen to class. Why? Everybody want to improve my situation better than yesterday, right? Correct? So you have the 2 hour, maybe some kind of contents, maybe 1 minute, one contents, good for you apply your lifespan, you change it, you have money, you make money today. You're lucky, right? Some people don't come in the show, the class, or the other place, or whatever. So you stay 2 hours. I teaching my evidence or my research and then test book. Any kind of contents apply your lifespan. Maybe your whole person, your peace of mind, you're more happy, right? So I want everybody happy, okay? The step 5, the laying on of hand. If appropriate, the comparables, the physical touch, the traditional conduit or feeling prayer. So hand, because I want to give a hand the prayer, so maybe touch the shoulder or head. The where to place the hand, the usually on the shoulder, the head or specific area of pain. It is strict bound areas, monastery. Sometimes I pray for my patient, and sometimes I have the class in the church. I want to try to pray for somebody. I give the more shoulder here. Sometimes I have. So the logics will ground the person, the make the spiritual moment the physical reality. So the logics is ground the person and make the spiritual moment the physical, the reality. The step 6. The step 6, 7, 6. Step 6, the listening and need testing. The listening and need testing. So if you want to pray for somebody, before we had to more rule, right? So we have to notice what kind of the issue. So we have to let me know that your problem. So we have the listening and the testing. So all the time the listening, no speech side. So first, and the other people want the talk, the listening, and then we lead testing or question. The healing is the realist the job, and it's over. It's open the process. The healing is a realist the job, or it's over. It's open the process. Wait in silence. Wait in silence. After praying, the gift is a minute. Just in a minute after praying, 1 minute. We have quiet time, 1 minute. Because we pray for somebody, God watch the situation. We live together here. Now we are Christian here, right? We are Christian class, but we teaching and then you are learning. So God here, go together, this place. You understand? So if you wanna pray for somebody, maybe inside God or walk together here. Okay? The joy is sleepy, right? That's a movie, right? After praying, give it a minute, ask a person, what are you feeling right now? So is there any change or your peace of mind or your love is or so some angry or we have to know that to figure out the other people petition or the feeling. Very important here. I want to try to pray for person, but she's not happy. You have to stop, right? Because I want to try to pray but the automatic prayer, we have to stop. Okay? So wait the silence after praying, give it 1 minute, ask the person, what are your feelings right now? Is there any change or your mood is okay? You're sad or you're happy? We have to ask. But we have to 1 minute. Skip. Right? But check-ins, if they say the pain and from 10 to 5, we have a pain level 1 to 10, 0 to 10. Now I have 10, but you pray for me now, so my pain relief for 5 or 4. So you have to change it or the same, or how's your feeling? We ask first. Don't stop. The pain and from 10 to 5, don't stop. Pray again for the livings, the 5. So 10 to 5, but 5, so we start more remaining. This is often called the persistent prayer. The persistent prayer. 한국말로 안식이래요. The persistent prayer. So we have to mourn. Oh, feeling better. Now my heart is more better. The house your pain level is to 10 or 5 or 5. Okay, I more try. So please, I'm praying for the name of the Jesus. Please give the pain relief affairs. Get out some hair, the heat, the fever, was the pain. More try. Don't stop. The pray again for the remaining, the 5. This is often called persistent prayer. So usually the pastor invite the pastor to visit the hospital room and the home. So we give the prayer. So the patient, sick people, we more strong power. So I pray for hand, but it's God healing the hand. Okay, this is the persistent prayer. The step 7, the closing is greatly. Neglect or another person feel 100% better or exactly the same. You cross your focus on love and peace. The neglect or another person feel 100% better or exactly the same. You cross your focus on love and peace. The goal, you want the person to live feeling, seeing, and love. Like our faith was experiment if a miracle didn't happen instantly. So everybody wants a miracle. So my patient, take the herbal medicine. So everybody have sickness. So maybe 5 years have sickness from the something issue, the disease. So I give a herbal medicine. So maybe start 5 days, 10 days, much better. And they had more transfer. Oh my God, I'm much feeling better than before. We have to transfer. But later, the change because medicine is not cover all lifespan, right? We have to habit, sleeping habit, or dietary habit, or some the workness or situation, too much overtime, too much no sleep. Every night you have to see the cell phone. Very unbalanced or lifespan. But then or medicine. So, why this medicine not the work? Why? It's a good medicine. Because we have to more change in my life, right? No change in my life pattern. So just depend on only the herbal medicine, it don't work. So we have to, you want the person to live feelings, seeing your love, like afraid experiment, if a miracle didn't happen instantly. So miracle, if you want a miracle, you have to change everything. So I told you, right? The prayer before we had to more get out of my mind and then my behavior habit. So maybe you forgot everything. from yesterday, you print, you have new start. You're empty. So we have to fill up, right? So I have a copy here. I have a copy here. So I want a juice. I want a vegetable juice. So how can I do? Now I have the inside the copy, but I want a juice, green juice, vegetable juice. How can I do? Now I have a copy inside here, but I want the apple juice. So how can I do, Joe? Joe, how can I do? I want the juice, but now inside the copy, how can I do?
You change the coffee into juice.
Yeah, how can I change it?
You throw away the coffee.
Yeah, correct, right? So now we have to play over this set of our lifespan. How can I do it? We have to poke out, right? We have to change it, right?
Change.
It's empty. That's why the new coming inside here. So I want to juice through away. Empty cup, and I have to washing, right? The little bit change the taste, no good, right? I want to change the cup, or I have to change it inside the throw with coffee. So I'm putting the juice, right? The same thing here. So we have to reset up our lifespan. The post-trauma or behavioral habit, we have to change everything. Empty. Today, the new start, right? The operative or the failures, one of the hardest part or healing prayers, the when nothing is similarly happens, honestly, the practitioner the suggest. So sometimes the healing, maybe you have light, so we can see light, but dark over, we turn off the light, you do that with our light, right? The no light. So sometimes you can see, oh, really unchanged the ability. So really we can figure out, oh yeah, it's a work, and we change it. But sometimes I want to see something I can, right? The example, sometimes we are outside all day outside here. I come here, inside here, the color dark, right? The same thing. You understand? So I want to see you're bright, but sometimes we come in here, the inside here, the classroom is not bright the same. But later, maybe after maybe 5 minutes, 10 minutes after, it will be the return, your the ability to see, right? So here, one of the hardest part of healing prayers, when nothing similarly happen, authority or practitioner suggest, don't take the credit for healings and healings, and don't take a blame for the lack of workload. Okay, so yeah, sometimes we want more work, but sometimes I want 100%, but sometimes 70% or 50%. So don't blame, right? Don't blame. So don't take credit for the healings, and don't take the blame for the lack of growth. So we have to survive. We have to step by step. We have to continue. So don't blame. So I want 100, but it's a 50%, 70% lack of my separation. So we have to don't give up. We have to keep going. Okay. Your job is the input, the love and the prayers. Output is a too higher power. So your job is the input, the prayer. But after the receiver, the prayer input, the receiver output, the more power, the high power, the peace of mind, the more joy, or the solution of the issue. Okay. The counseling prayer. So we healing prayer we explain. So everything is okay. You understand the healing. The prayer, the personal issue, and direct to the God, okay? And then now, with counseling prayer, we explain what's different, and then later, after we explain the counseling prayer, after what kind of the issues overlapping or integrate, okay? Now, we have the divide, right? We have a divide here. integrate, but there is overlapping, right? So what kind of issue is overlapping? The healing prayer and then counseling prayer. The second counseling prayer, on the other hand, is our therapeutic tool. That the therapeutic healing prayer, the personal coaching, the prayer, the individually, the healing power, and counseling the power, the therapeutic. So just for example, the pastor, the pray for you, your lifespan, your situation, okay? And the healing power, only the pastor or minister or the church leader, the pray for you, your the situation. But counseling prayer, the pastor plus and psychologist or counselor or doctor, so together. Okay, so therapeutic. You understand? Yeah, so the personal healing prayer, the healing prayer, just the human, the public, and the therapeutic, some pastor or team leader, the plus together, the specialist or doctor professional, the therapeutic. The therapeutic tool can support emotional processing, the defense work connection with God, and offer grounding amount or vulnerability. So usually medical ministry. So many people have a group, the doctor group or special group. They more join the Korean culture, Korean the church community. We have every year one time we visit Mexico or China or some area, Dominica. We send the medical missionary. So sometimes the Korean church have a lot of missionary camp. So the pastor usually church member they going to together, but they little more specialty, right? The specialty or more work, the voluntary. So many people the group, dental or the Chinese medicine, the acupuncture or some the counseling. The people more join the medical program. The counseling phase, on the other hand, is a topic tool and can support emotional processing that depend on connection with God and offer grounding moment or vulnerabilities. It is used in more context or topic to help clients, the church member, navigate the conflict over their own mind and the soul, the provide tool over emotional healing. So, help client navigate or conflicts over their own mind and the soul and their personality, and to provide tool over emotional healing. The counseling prayer, where the more focus is today. This is a more integrative process. We have to integrate process that use prayer tool within the border, the therapeutic or guidance based or conversation. The therapy border or therapeutic or the guidance or based conversation they within the use the tool is more growth oriented. So we have the foundation of our healing power, the personal healing power and the healing prayer, the foundation, and also here more growth oriented. So we have to integrate and we have some overlapping here. The pound over the house. So it's more growth oriented. The premier goal, inside, input, output, inside and then transformation. The intent is to gain the clarity, the process, emotion, and aligns also with the spiritual principle. The emotion and the aligns also with the spiritual principle. So we have this person, spiritual power is relative or political. So how much have the great word the God or have the belief in the God? how much have connection with God? Is one first of all very important here. So we have a different way and different approach. The therapeutic or the healing, the prayer or constant prayer. The most of all we have to check the spiritual power, the person. The power source and praise God presence through the process of self-depletion. Now say self-depletion, the wisdom and corrective shift. So three parts. So self-depletion and wisdom, the corrective. So we together the part over the part, the oriented, and this navigate, and healing power, the foundation, and oriented is top here, the self-depletion and the wisdom and the corrective shift. So we integrate the overlapping. The settings, the usually takes place in private, describing one or one section, the pastoral counseling or spiritual direction. So this is private. The healing power, healing prayer, I can pray for your people one time. And so name of Jesus, please my students more healthy and more the good finance or good and healthy, more please more hopefully the lifespan. Please touch them. Do one time we can touch your prayer for one time. For counseling the prayer one by one, the private, because the therapeutic mean it can healing power the prayer then cover all everything, right? So we need more accidental more therapy tool or treatment. So I can open the public. So each person individually have the problem in the issue, right? The private. So we have to keep the script and we have to one by one, each person. Okay, so different. The healing power and the healing prayer is a public together. In the church, okay, church, yeah, the church service or and public areas, so we can you can do. But the counseling is a private. Okay, limit one person. Declaring one person, one session. The participant role, act or collaborate. So participant role is active and collab. The collab means we are separate, we have to work together to rate the collab. The person take thought their issue. The using the prayer to listen for the still small voice or internal speech. So the public must be more strong and powerful to hear, but one by one, the private smooth and the voice volume down. The please maybe Another Joy, please Joy is oversleep this morning. She's last night all night this movie. So she's tired, so please. So it's a more low voice, right? Low voice, and because internal peace. Maybe Joy, get up. It's strong mess is no, right? It's a counseling the prayer, the private, and then low volume because in the peace of mind. Okay, it's an internal peace. The temporal focus. The focus on the journey is about developing long-term coping, merchandising or spiritual maturity over time. The healing prayer, short-term and temporary, but his counseling prayer, the long-term coping, the merchandising, and the spiritual maturity over time. Okay, it's a lifespan, not for a long time, longest stay. But the healing power, there's some issue. Maybe there's some person, maybe sickness, some the cancer or something, so we have the long term we prepare everyday thought. But suddenly this morning you are headache. Something is short term, right? The temporary. So this is the difference. The healing prayer and the calm prayer. The common use case, the marriage, the common use case, the marriage string. So relationship, husband, wife, the marriage life is something broken, something unbalanced, unharmony. So marriage string, anxiety, the grief, the habit breaking, or navigating the complex now life decision. So we have to change the address because I am to more overstay, or I am to more now. So I have the big house, but I bankruptcy. I have to change the new small house. So we have the lifespan. We have the decision and grief for the anxiety, the trauma. So maybe struggle, finance issue, the common use case. The big difference, the healing power, healing prayer, and counseling prayer was different. The big difference is explained to you. If you have a broken leg, for example, the she's a broken arm, healing prayer asks for the bone to keep it back together instantly. Counseling prayer asks for patient or endure the cast and wisdom to learn why you tripped in the first place. So the big difference. If you have a broken leg, healing prayers ask for the bone to keep it back together instantly. But counseling prayers ask for patience to endure the cast and wisdom learn why you tripped in the first place. Okay, you understand? So you have a good example, right? You broken the arm. No, you hit your husband, right? No, lucky. But healing prayer, the praise the name of Jesus, praise the bone, the capstone, right? The priest recovery fast. But counseling prayer, how can I do? It's a very uncomfortable, this one. So priest every day, priest more the bone, is more cat, more recovery, and then she had depression. Priest she don't have depression, the peace of mind. There's something, right? The difference in long term. So here the prayer ask the counseling prayer ask for the patient to endure the cast and the wisdom to learn why you are tricked in the first place. So when do you lead a prayer? Okay. Sometimes you pray for the God, right? So when you lead your prayer, you by yourself, when?
5 times every day.
Okay. How about you?
You don't need only prayer for asking, but you pray thanking God also.
Do things,
pray,
no listen.
Thank
No need, nothing. You pray for your God every day. Thankful.
Yeah.
You're reading, are you open eye?
Yeah, you thank God for today, you're alive, you can breathe, and also for guidance and for that day.
Okay.
And you can also pray for thankful for the food that you're going to eat. And if ever you have like a anything that you want to ask in prayer, you can do that. But what we're talking about is maybe the counseling prayer and the healing prayer. When you feel something's not right in your body, you pray your healing prayer because it's specific on what you feel.
Okay.
So that would be you're going to I pray whenever I feel something's not right.
Okay.
So but that's on my person. Now when you pray on another person, that's a different thing.
Yeah. So do you mind if you have your big issue, your health before you have the big issue, surgery or car accident, or you have an issue, the first time your lifestyle, you have or not? your health all
The
time?
health issue, yeah. You have that too, so you pray for your health. Sometimes maybe a surgery before. Yeah.
That's right.
Yeah.
Because me too, I have experience. I almost medical the diagnostic. Almost 90% I cut my leg to both. So I can realize my situation because my previous doctor say you have to cut here
Oh.
tonight because you not cut tonight, maybe tomorrow, maybe you can die, right? So, but I'm not give up. And then why this is coming to my leg? The problem, why? What happened? I'm handsome. I'm very good person. Why? Why you give me this the certain time? I never blame. But I want to try because even I treatment my patient. So I sick, but I healing the person, the people in my clinic. So why? But I want to try. I want to fix myself. No, I already. Maybe God takes my life. It's okay. Yeah. But I pray. Thanks God every day. Pray. So after some big issue, your lifespan, maybe your answer, right? Just I work, thank you. I can eat, thank you. And I can see, thank you. Right? But some people, they don't know. But we have some big issue is my lifespan, was financial issue or some the health issue is more still we find out, right? Do you have experienced your big issue, health, your lifespan? Surgery or some car accident, anything? You have?
Not much. Maybe
Not much?
like a car accident sometimes.
Not big, that's small. I'm the roll over 3 times. I almost died. But how about you? You have a big issue, your health problem in your lifetime?
No, just before coming USA, my body's whole body like very sick inside of my internal organ and all things. But after coming here, maybe California sunshine maybe heal me, or God give me healing power.
Okay.
So I myself healed all my. I am very healthy right now,
Okay.
and
Good.
then I could heal people.
Okay.
So that's why I am very interested this
The
chapter.
class. Okay.
Yeah. So
Okay.
I know this like a theory,
Okay.
but I did the healing prayer for the people, and they healed. For example, leukemia. But on those days, I did not know what is leukemia,
Okay.
the word vocabulary.
Okay.
But the lady come to me. I was healed leukemia. So another person is that's a professor. Healed. My personal opinion, just like when we over the prayer people, then the sickness we can divide like
The joy is
one
more plus.
is like we could pray by God, healed by God. Another sickness is not the prayer subject sickness. So we need like prudent to like here sometimes it gives broken bone gives those things like we could pray for the like quick recover.
Yeah, recovery.
But That is not healing prayer subject, but my personal opinion.
Okay.
Yeah.
Yeah, thank you so much. Okay, so everybody have some issue. We prepare myself and somebody give the hand the visible position, but sometimes we have to pray the side. It's my position to pray for somebody, but sometimes your visible position with some the God or some the church member or some the people, right? So when do you lead prayer? We can all pray all the time. So no listen. Sometimes very happy we don't need to pray. Sometimes we have some the screen time or some the set time we pray for no. So all the time. The Roma 12:12, Colossians 4:2, there is the Bible 17 on community is for never stop praying. The three Bible the context, the Romans, Colossians, the Thessalonians on community thought never stop the praying. Thus plus the path, the Jesus craft parable encouraged to keep as its for example. See Luke 18 about the widow keep the petitioning or judge defined her. The cruel words in that sometimes our prayer don't at least instant answer. Okay, here. Luke 18, 누가 18 about the widow, the who kept petitioning or judges to define her. The cruel earth in that sometimes our prayers don't at least instantly answer. Okay. When do you need therapy? So before we had to when do you need a prayer and when do you need therapy? It's a more more grow oriented. As of these writings, I will work as a licensed psychologist for 16 years. I have treated a client with bona fide clinical disorders and also a subgroup that attempted was self-medicate, which then earns them the dual diagnosis that because they had copy is not just the instant disorder, but also the addiction that developed afterward. Okay, we have given a sample. Some people, the behavior is not normal. If and I come to Sunday school, Sunday church, I drink alcohol, maybe I take alcohol in the morning, and I attended join the service, the church service. So you know that Dr. Choi is a drink this morning. So you or tequila or whatever, yeah, liquid. But one time, okay, but usually I'm not drink. But because under overnight drink, but not this morning. But you can feel, you can smell. Oh, maybe he have more alcohol, right? So maybe Choi drinking this morning and join the church service the one day. But I explained, no, last night, but it's not covered. My liver function, not too much work. So still the smell. But every Sunday coming, but every Sunday same situation. So I'm dying. Every morning I had to drink alcohol. So coming to join the church service. So one time is okay. Okay, excuse okay. But every Sunday, maybe 4 years, how can I do? It's okay. It's okay. Or maybe alcohol addiction. I had to looking for some the specialism or counseling or I had to go treatment, right? So first time okay, first time it's good. Maybe you can do something, right? But every year, 1 year, 2 years, the same problem. Every Sunday morning, my body, the smells alcohol. Yeah, marijuana too, marijuana or alcohol. Every week, every month, every year, is something problem, right? Not easy, right? So we need some addition treatment, right? Yeah. So here, which then earned them to do diagnosis because they had to copy in not just the irritable disorder, but also the addition that developed afterward. So we had the counseling, the plus the therapy. So the pastor, you can give the prayer for the person, but you can try the prayer, but we change your mind or something is okay, this is okay. But the alcohol addiction, you can change it, right? We need some specialist counselor, right? So when do you need therapy? You understand, right? The example. But that's not all. I've also seen the client who had no formal diagnosis at all. They sought my help for non-clinical matters, like wanting to feel more confidence or communicate more clearly. The having previously discovered IF therapies, the some helped company to learn more about their own internal world. The couple signed up to start their marriage. My client, various background, convinced me that you don't need your extensive trauma history to make more appointment with a therapist. That everyone can benefit from seeing the mental health professional. So, yeah, so many issues. Now, the neighbor, my church member, some people have each family have some discrete issue. My son have an alcoholic, my son the trauma, mental problem. So I don't want to open mind, right? Even they want to bring to a counselor or the professional clinic, they don't want to open mind 100%. They want the hiding, the history, trauma is my mental problem. So because we want to change the situation, we have to open mind. But some patient or client, they want to hide it. So they don't want to open 100%. Okay, this is situation. I want my clinic 10 years, the same. So we have the more good relationship, they try to more open the history. But my client body background confidence means that you don't need a extensive trauma history to make an appointment in a therapy. Everyone can benefit from seeing the mental health professional, but the police slide, the seeing a therapist to the top of your do list if any or following apply. So you have more the cousin, so we have to looking for the therapist, the top of your list if any or following apply. So even the patient client had more list. What kind of issue is my poster? We have to change it. We have the solution. We have to fix. So we have to even the patient had to make some the list too. And the therapist, so we have to more learn about the client history, the background or some the trauma and some the history, life experience history. So you have trauma. I will explain the trauma, the post-trauma and child trauma, and recent trauma means the second trauma. So maybe you have the childhood trauma, the post-trauma, the maybe 40 years they have trauma. But now recent trauma, present trauma is second trauma. Okay. So what's different? What's overlapping the trauma? I want to explain to you. The recent trauma. The things over psychological trauma as any advice the event that overframe our ability to respond. Example include experiencing the unexpected death of a loved one. Yeah, example include experiencing the unexpected death of a loved one. I have experienced my dad passed away 3 years ago, and unexpected because my dad we calling the before 3 days passed away. I'm Choi, I'm okay. My son, I'm okay. Maybe I'm recover a couple of days and passed away. So unexpected the situation. So I'm the trauma. For almost 3 years, I'm still trauma because I'm not ready to send the car to my dad. It's an unexpected situation, right? So you have to include experience or unexpected death or love on the losing your the buildings in fire. Maybe fire house. So unexpected, right? And the car crashed 2 years ago. Every for March, end of March, and my heart, my body, memories injury my car. Sometimes I will satisfied and some almost cover the 3 years I roll over. I want to try the Saturday morning, very late day, so I want to be careful driving slowly. I want to come here the kitchen, my car, I want to no speed, slow, but there is some the plastic that sliding my car, no here and roll over 3 times. So suddenly all the workers, my situation, I don't know that what's going on, and then my body I can move anything and roll over 3 times. Too much damage. So unexpected something happen, so we give me the trauma, right? So how come we have the more solution to trauma? We see here. Entering the serious accident and witnessing or serving the violence. Yeah, witnessing or serving the violence. If a result instead what traumatize you, there will be sign earlier. Pay attention to your daily functioning. If your sleep disturb or after accident or some issue, is your sleep the disturb or do you have a nightmare? It is a sleep or outright insomnia, or do you wish to sleep away? So this kind, nightmare and overnight insomnia, or do you wish to sleep away? So maybe temporarily it's okay. We can try the more chamomile tea and then we add more banana, the honey. It's okay. The sleep aid, the melatonin. For over 3 months, 6 months, with continued same symptom and the situation, we need a counseling. We need more treatment, right? The how is your activity? Is my activity okay? My diet okay? I don't want to sleep, so I can eat all day. So how is your activity? Has eating been out of control? The eating disorder. This means that I want to skip the fasting or I want to overeating because there is some problem. The brain, the level problem. So I want to eating every day more. But I don't want the kid because I want to diet. So how is your activity and has eating been out of the control? Now notice for and over spectrum, whenever you have a consumer too much or not enough, whenever you have a consumer too much or not enough, the secret is your mood as well. If you have a mood swing, loss of our motivation, mood swing or loss of our motivation, and listlessness, anxieties, or agitation, there is a strong reason to contact the mental health professional. So swing more, mood swing, loss of our motivation, or listlessness, anxiety, or agitation, or there are strong reasons to contact mental health professional. So this kind of issue, this kind of situation, you will contact professional much better because we have a middle term, short term, middle term, long term. So 6 months, 3 months, we have to think about it. Okay, contact if you have some issue. The same goes the intrusive and recurring thought, as well as the flashback and then memories over troubled orders to your wisdom. So as well as flashback and then memories over terrible orders to your wisdom. For generation, many Christians have been conditioned to mental health fully spiritual battle. Yeah, spiritual battle. We textbook names the Christian spiritual warfare and counseling, right? The for generation, many Christians have conditioned to see mental health struggle as a fully spiritual battle. The spiritual battle, the spiritual warfare, the same mean. The best part on the kidneys, anxiety is toward the cast or lack of trust in the God. Anxiety is why anxiety occurs. Anxiety was cast and the lack of trust in the God. Depression was evidence of weak faith. The different anxiety, the cast and lack of trust in the God. Depression was evidence of weak faith. This is a topic that was for people who didn't believe enough. So many suffered the silence, convinced or seeking or professional help would betray their devotion to God. So it's not enough. The depression was evidence of faith. Topic that was for people who didn't believe in God. So too much anxiety, too much depression. You understand here why anxiety? Cast over the God. Cast and lack of trust in the God. So anxiety. Depression was evidence of weak faith. So many suffer in the silence, convinced or seeking professional help would destroy their division in the God. Okay. So Amadis argues that this mindset is just harmful, is deeply unbiblical. If you had more love on who was diagnosed with cancer, would you tell them to just pray about it? Or would you also help them find the best doctors, start researching treatment options, and learn on medical experience or mental health no different? So you had to more pray for some people, the cancer patient. If you had more love on who was diagnosed with cancer, would you tell them to just pray about it? Is the overall is good? Is enough? No. Would you also have them find the best doctor and start researching treatment option and learn on medical experience, or mental health no different. So I heard my mom 1 month ago. I'm very shocked because my sister, I have one sister, one brother. One sister is under 2 years. She's job is a teaching person in the hospital, CPA. But my sister had the breast cancer. 6 months ago. So she didn't find out the quickly, it's a little late, but now the chemotherapy 6 times, okay. But everybody know that the secret, my sister would want to tell my mom, but my brother talked to my mom. Why? My mom's worried about the daughters because only we lost my dad 2 years ago. So my mom is overcome the mood. My mom don't want the depression. So the sister don't want to tell her. But even she don't want to tell me. But now there's sometimes contact, but she don't want to tell me. Brother, I have the blood cancer. Don't tell me. Why? I'm worried about her. So here, just I'm praying for her. It's my job that I healing the person, and then I have my own clinic
and all the time I'm the counseling dietary and the cancer patient or some people and help them. She don't want me my help. Sometimes I just pray. That's this situation. So my mom say, okay. My mom say just you say to pray for her. It's not enough because I'm not a public person. I have a professional, right? So I have my knowledge and experience. I can give hand. I know they have a doctor, good doctor, but I have my patient. Maybe I can give some dietary or naturopathy or nutrition counseling. But so if you had a loved one who was diagnosed with cancer, would you tell them to just pray about it? It's not enough, right? So if your family have your classmate or your church member have cancer, suffer from the cancer or any kind of disease, just pray. Not enough. You want plus, you can try to give them more information. Okay? So this one. The start researching treatment option and the learn medical experience, mental health is a little different. So more approach to more help the person, the prayer. The prayer manpower is good, but more plus. Okay? Just the prayer, no. We have more plus.
Can I say something
Yes.
about that? I think in my own understanding is
Okay.
that it has something to do with culture. Because because here in America,
Yeah.
American culture,
Okay.
when you say mental health, that's one of important thing in their
The body?
their lives.
Okay.
So they have that, like dental health, mental health is included with their health.
Yes.
But in third world countries, it is not so. It's not the same. In third world countries, mostly because some do not even have proper hospitals. Mental health is not an issue.
I see. I understand.
It's aside from a cultural thing also, people in first world countries, because they have the facilities, they have the capacity for doctors of mental and physicians, so they can offer that sort of thing.
Yes.
In third world countries, well, I'm not saying, I'm just doing a specific mental health. You would say, just pray for it.
Okay.
You know?
I understand. It didn't matter the country, the America or Korea, Japan or the Philippines, it didn't matter. Because I want to focus here. For example, the conventional medicine, the medical field, they divide, right? The dental doctor, we have eye doctor, we have everything they divide, right? Yeah. But the natural medicine, the holistic medicine, the whole body. So I have cancer. I have cancer. But why the connected to mental? Well, sometimes some people have a lot of the medication. The basket, right? Maybe some people 10 or 12, the vitamin or supplement or prescription drug, everything. So maybe I have cancer, pain. So pain doctor give the pain pill in digest. So maybe they give the pill. And I'm headache. So maybe they give some of the medicine. So in the part, right? But yes, the body, whole body. So whole body means we're, for example, I'm the study of mind medicine, the Harvard Medical School, and I study the life coaching, the psychology, and the natural medicine. So we see the whole body. So something I will maybe too much pee every morning, too much all day. So maybe the conventional medicine, they only check here, first check. But natural medicine, maybe you have too much anxiety, you too much stress, you going to too much the pee, restroom. So the mental, what's different to us? Sorry, why the mental and then cancer or some issue because the whole body. So conventional medicine and the best natural medicine, the holistic medicine. So the subject, the Christian word inside here. So
conventional medicine only the part, individual part, right? But the Christian culture, in the Christian world, the God creates my body, the focus spiritual, mental, emotional, and the inner, the internal, right? And then movement, everything. So it doesn't matter country. The same thing, yeah.
Also, in America, their culture is like individualistic.
Yes.
They are like they don't want to do anything with their neighbors, so they keep to themselves.
Yes, yeah. The Korea is a more community together. Here, also Japan too, right? Japan too individually, and then American too individually, not together, the public, yeah.
That's why they cannot express.
Yes,
they cannot.
yes.
Now, when you go to the therapist, they let you talk.
Yeah,
you
I
know,
see.
talk.
Yeah.
Now, in the Philippines, everybody's talking and
Talking,
talking
that's
and
right,
talking.
yeah,
So,
talking, yeah. Yeah, but Korea too. Korea talking, we work together, but now it is changing. Individual part. Before, think about it. Long time ago, 1950, 60, 70, we have not much technology, materialism. We met the village, right? So we don't have a locked door. But now, everybody, the building, apartment, right? So everybody locked the private, right? So maybe sometime you change it, room A, B, C, D, but sometime A is pass away by itself, right? We don't know that, right? But before a long time ago, we know that maybe, the Steve passed away, so we know that, right? But now, the Steve live A apartment and B, this is my door, doors, right? But we don't know, so the culture is different. Maybe later, after 10 years, more. So the culture, the different, sometimes, you are correct. The culture is different, right? But basically, it's the conventional medicine and then natural medicine different. Natural medicine, the whole body. They check the spirit and the mental, and the emotion, and the physical issue, everything. But conventional, only the part.
Okay.
Yeah, so the Christian culture is Christian because we know, right? Who made the body? The God, right? God created everything. So God knows my spiritual power and the mental problem, the issue, everything, all right? Yes, so that's right. So your opinion, I upset, but we focus in the class, the Christian culture, and the whole body, okay? The ideas, the path to more happier somehow, with the others, the path of dystomy, is really they have a complementary tone. The complementary role is integrated same relative. Two sides over same coin. Yeah, two sides over the same coin. One coin, we have a front, the back, right? Yeah, so we have the healing power, healing prayer, the constant prayer, in the back or front, one coin. The prayer connects believers to God. For therapy, we keep them either more tool, navigate or accomplish over their own mind. So with the own trust, we have the one coin in the back of front, but we had a treatment or some the therapy is we have more air. So tool navigate or accomplish over their own mind. Not simple, it's a complete. So we have an integrate, overlapping. The question central prayer, the technique. The question central prayers, open call, inquiry, based prayer, or listening the prayer, the shift, the focus from the monologue, where you tell God what you need. So where you tell God what you need to dialogue, where you ask target question and the way for internal approach, the scripture was shifted in your perspective. The thing over is moving from glorious list, the style over praying to consolation, the style. So we have Christian centered prayer technique. The core biography,
instead of trying to convince divine, you need to change your circumstance. You are asking for the insight to see the circumstance from the different vantage point. It's a bit under ideas that still the small voice is often waiting for invitation to speak. So the still small voice in the open quiet time. So we have taken the prayer for somebody. We have to 1 minute the waiting, right? We have to response. Well, how's your prayer? The prayer will little change it. So the still small voice and open waiting for the invitation will speak. Keep taking your approach. The immunal approach presents base. This focus on the perceivable connection. Instead of asking for the stuff, you ask, God, where are you in this room right now? God, where are you? I need some the prayer. I want to more solve my situation now. I have the screen time. Where are you in this room right now? Or what do you want me to know about your present this memory? What do you want? What do you want me know about? God, please explain to me what you want from me. So why I have this issue, situation, by screen time? Why? Explain to me what you want. That you are present in the memory. So we have to more list the God, the question, and in the center of your mind. What do you want me to know about your present in this memory? So who asked the God? Yeah, so please, God, give me answer. So what do you want me to know about your present in this memory? The root cause inquiry purpose near healing, used when feelings or triggers emotion. Trigger emotion, the trigger means we have the first time something you continue present. The trigger, like a sudden anger or shame, you ask, why am I feeling this level or intense right now? What is the lie I am believing about myself in this moment? The two top, the why am I feeling this level of intense right now? Or what is the lie I am believing about myself in this moment? The evaluation과 exam review based or structure techniques over looking back at your day is the two central question. When did I feel the most alive or connected today? The consideration to when did I feel the most drained or disconnect situation. So we have two questions. The identity question, a powerful tool for self-worth. You ask value. You ask, what do you say that I am? This means bypass your own inner critic and listen for hiders the perspective on your value. Yeah, this means the bypass your own inner critics, listen for hiders perspective on your value. The three ways inquiry. When stuck between the two choices, A or B, you ask, is there the twist way I'm not seeing? This invites creative problem, the solving into a spiritual space. So we have a question and the who, the God. So here, the key technique in the approach. So you have to more the request the God, the skills. How can I do now? I can by myself, I will control. So I need your help. The God give me the direction, the guideline. Yeah, this means the how to practice step by step. So we integrating prayer, counseling skill. So we have the how to practice it step by step. So please no rush. One, settle the strict. Take 2 minutes over silence to dial down your own internal chatter. So, first of all, you want a prayer time. No less, we have to organize your sacrament environment. You clean your desk with down in the middle of the Bible and the memo and the water. So, settle the strict
take 2 minutes or silence to dial down your internal chatter and then peace of mind to calm down. To the single question, don't paper the universe is a 20 question. Don't paper the universe is a 20 question. Pick on the specific, open and the question. What is the one thing I need to focus on today? So we have a 20 kind of list. So first of all, I had to change my situation and anxiety mood or stress mood. So we have number one, we pick up only one. Don't multi option. Don't take the option, the server, only one. What is the one things I needed to focus on today? The activities. This is the hard part. You aren't thinking of an answer, you are listening for thoughts that doesn't feel like you're on. Often thoughts that is kinder, more creative, more convincing than your usual mental loop. Yeah, so we have the active waiting. Number 4, the wide and the test. Method, just down whatever comes to mind, no matter how well that is. Evaluate it is a loving, why it's a right, we are done, duty is a sign, is a core value. So we have a, there is the elevate is a loving or right or the value. So we have to more focus on more optimal, the issue, and then we have to pick up, and then also you have the matter, the solution. Approach, if you find yourself getting answers that sound exactly like your own answers in your traffic, your failures is negative. That is usually just your goal, ego thinking. In these techniques, the divine response or potentially catered by peace even when it's challenging you. It's very important here. The healing prayer. So we summary now. Healing prayer, the emergency room of faith. The emergency room. Somebody now emergency room. The healing prayer typically divided into two characteristics: the physical healing, mending the body; inner healing, mending the soul. Okay, the physical healing, mending the body; the inner healing, the soul, the spirit. The command models often say the physical healing. This is assertive rather than your political request. In the command, the condition to review based on spiritual authority. The pain, go in the name of Jesus, please pain leave with the infection, the body, please go away, so please the control of the pain. The inner healing models, the third word TPM, this focus for emotional trauma. The techniques, the facilitating the happier restore painful memory and identity, like your believer in that moment. I am always alone. So your sickness or isolate or loneliness. So I always alone. So you have to believe practice to help you restore painful memory and identity. The goal, you then ask God to replace that like truth. It's like a spiritual surgery. Find the suffering, fully out, and then let the wooden cross. Okay. The difference aspect, the sometimes healing prayer involve clearing the air of what practitioner call spiritual operation or stronghold, the removing external the spiritual interference that block the holiness. You're cleaning the air, the mood too. The what practitioner call the spiritual operation or stronghold, removing external spiritual interference that block holiness. The counseling prayer, the long term, the physical therapy. The emergency room is a healing prayer. The counseling prayer, the long term, the physical therapy. This isn't about on time, the miracle. It's about the sustain the partnership. It ranges from the clinical therapy to spiritual mentorship. The clinical Christian counseling. I have the books, the Christian oriented counseling in the book. So here, clinical Christian counseling, their licensed therapists, APC or LCSWs, who use standard psychology like a CBT, but incorporate play to help process the feeling. Here, incorporate play to help process feeling. Example, using word chair exercise, the way you imagine are the sitting in the room as you voice your anger, you calm down, and then some you have the deflation, the meditation or some the plan down, the mind control.